Good afternoon, everyone. Welcome to today's team brief. Dave's away in London today, so we've got myself, Phil Bolton, Chief Nurse. Fortunately, I've got some company. It'll be pretty tedious listening to 30 minutes of me. As usual, we're going to start off with a few updates and topics of interest. I'm going to talk to you about the Paul Robinson celebration event, some NHIS updates, and Tulip Daisy Awards. We've then got a few items that colleagues are here to talk to you about. But let's just start by going around the room and letting people introduce themselves. Many of the colleagues here you probably met before on the brief or out and about, but we'll go in order of the list. James.
Hi all, I'm James Thomas. I'm the Acting Deputy Medical Director.
Amelia.
Hi everyone, my name is Amelia. I'm the People, Equality, Diversity and Inclusion Support Officer.
Amy.
Hi, I'm Amy Gouldstone, People Wellbeing Lead, and I'm also this Disability Staff Network Chair, which is called the One Network.
Thank you. Mohammed.
Yep. I'm Mohammed. I'm the OD and Engagement Lead across the Trust.
Jacqueline.
Good afternoon, everyone. My name's Jacqueline Reid. I'm Associate Director of People Operations. And
most importantly, we've got Liv with us from the comms team who's making this all happen in the right order. And I'm probably tipping her over the edge by going out of sequence and out of order. So if things go wrong, it's probably me, not Liv. Let's go back to the topics we said we'd give you an update on. So most importantly, I want to start by telling you some of the arrangements we've got in place to celebrate Paul Robinson's life. So tomorrow is Paul's funeral. A number of us are going to that up in Sheffield where he lived. But we've got a celebration event next week here on Thursday in Lecture Theatres 1 and 2, Thursday the 27th at 3 o'clock. You'll see some more comms come out about this, but really keen that you take the time to come down and celebrate Paul's life, and the opportunity after a small 30-minute service for people to talk to each other and share their sort of stories and experiences. I know Paul's wife and sons are really keen to come to that, so hopefully they'll be there as well. And I know they've already taken great comfort in hearing the impact Paul's had on people. And while we know Paul's impact at work, I think some of that's come as a surprise to his family. They didn't quite appreciate how well liked and the impact and reach he had. So thank you for those messages and thoughts you've been sharing with people. It's really meant a lot to ourselves as colleagues and Paul's family and friends as well. So there'll be some more information coming out this week, I think on Thursday's blog. We are asking that people respond to say if they're coming, just so we know the numbers, which will help us manage that event. So there'll be a link available for you to acknowledge whether you'll be coming or not. Don't forget, we've got the books of remembrance, which are available in the Faith Centre here at Kings Mill and also in the general office at Mansfield Community and Newark. And there's also a virtual memory book as well, but we'll send all the links out for those as well. So really important event. I think it's really important we recognise and celebrate Paul. That's next Thursday at 3 o'clock. So look out for the information on that. Moving on, a couple of updates from NHIS colleagues. So the Blue Sphere system is having an upgrade tomorrow at 2 o'clock. So the system will be down between 2 and 4. So if that's the system you use, please make sure you log off before 2 and make sure you go back on at 4 and check that it's working. The business continuity plan in the theatres is all up and available with paper backup systems, and the senior team down there will be able to guide you through if you've got any concerns, as will NHIS colleagues. So it doesn't affect all of you, but particularly those colleagues in theatres, you'll know what we're talking about when we talk about Blue Sphere. We're also having a Windows 11 upgrade, and the NHIS team are asking for volunteers or champions to help be early adopters of this. If that's something that you're prepared to do, we'll put the link into Nick Coulton, who's the NHIS project and business change manager. If you can email Nick, he'd be really keen to get champions across all sites just to test this out before we go live after April. There'll be full support from NHIS team, so don't be too anxious about all these systems going down and collapsing and you not being supported. So Liv will put that in the chat at some point as well. A final update for me is around the Tulip and Daisy Awards. We're going to talk about staff survey later, and something that came through the staff survey was the need to celebrate and recognise each other and the impact and the good things we do. And something we've done for quite a number of years now in nursing midwifery is the Daisy Award, something that was brought in by a family of a patient called Patrick Barnes in America who had a motor neurone type disease. And in his final days of life, and when he died, his family wanted to do something to remember him, set a bit of a legacy. And they were impressed by the care and compassion he'd received from the nurses during that period. So they brought in the Daisy Award, and it's an opportunity for people to recognise the impact that nurses have on our patients, something that's gone over and above. So the Daisy Award was specifically for nurses and midwives, because that's what the family who set this up wanted to establish it for. But we then rolled out the Tulip Award, which is a similar sort of thing, but for non-registered colleagues. So what we'll do is share how you can recognise and nominate colleagues in your areas that you perhaps think have made an impact on you or patients, someone that's gone over and above. And it's a chance just to recognise and reward staff for the impact that they have on their patients and each other. As I say, I'm sure when Jacqueline and Mo talk later, one of the areas of focus for this year will be about how we strengthen and broaden that recognition, because we've been doing this certainly the 3 years I've been here, and it has a real positive impact on our colleagues. It's good, isn't it, when people tell us that we've done something positive or we've made an impact. It makes us feel better. So I think it's really important we think about how we can all do that in our daily lives. So that's my update. So I'm going to take us on to the agenda, and I think James, you're going to go first and talk to us about blood type event tomorrow. So over to you.
Yeah, thank you. So I'll get the date and time out first, and then I'll finish with it again. So it's tomorrow at the KTC at Kingsmill Hospital between 10 o'clock and 3 o'clock. The essence is this. So Sherwood Forest Hospitals uses about 300 units of blood a month, and the NHS as a whole requires a huge amount of blood weekly. Last year, 1.5 million blood donations were made by about 800,000 people, but the number of donors is going down. And to keep that supply stocked and there when people need it, the NHS needs about 140,000 new first-time donors every year. And the uptake of that is going down a little bit. So we're going to do what we can to see if we can reverse it. It is the easiest thing to do to save somebody's life. You can give a pint out of your arm, and your blood is then split into 3 parts, and it can go to save 3 different lives. So a lot of us do a bit of life-saving during our daily work, particularly in A&E and, for example, critical care and other places. That takes a really difficult shift to do. By donating blood, you can save life by sitting in a chair, and that is a fantastic way to take part in the medical work that we're all trying to do. So tomorrow, the National Blood and Donation team are coming on site. They're going to set up in the King's Treatment Centre at the Kingsmill Hospital site. There'll be some confidential testing booths and a table of information. The team will be there. They will ask you questions about your eligibility. If you're eligible to donate, not everybody will be, but if you're eligible to donate, they'll do a finger prick test, and you will know what your blood type probably is almost immediately, within about 2 minutes, which is, I think, really interesting. You can then sign up to be a blood donor, and depending on what blood type you've got, if it's a particularly rare one, they might want you to donate a little bit more regularly than others. But then understanding your blood type will help you know when to donate and when not to as well. So again, really, really easy to do. A finger prick blood test tomorrow. Sign up to be a donor, and it's between 10 and 3 tomorrow in the KTC.
Thanks, James. So that sounds pretty straightforward, fairly painless process, and people don't have to book. I presume they can just come down. Is that right?
Just turn up, yes. We've got, I think, three donation booths, testing booths set up, and we've got a whole bunch of staff coming from the national team to run that with us. Our own transfusion team will be on site as well to advise people and to give out any further information. If anyone is a regular donor already and would like to be part of a Sherwood Forest sort of donation champions group to encourage others to donate, then please go and see the team tomorrow as well. We're trying to set up a little internal group for those that donate.
Brilliant. I think it's really important, James, as you say. And I think if people have got any concerns or questions, I presume they can just go down and talk to the team and people down there as well.
Very friendly team tomorrow. They'll be on hand to answer any question you have. And like I say, not everyone will be eligible to donate, and not everyone should donate. There's some people it's just not safe because of your own health issues. They'll talk you through all of that.
Brilliant. Thank you, James. And as always, something I probably should say at the beginning, the most important part of the team brief is you having your say. So if you've got questions for myself or the team, please put them in the chat. I'll do my best to remember, and we'll try and address and answer those. This is your event, and just listening to us rattle on isn't what we want. We want that two-way dialogue and conversation. So please fire your questions if you've got any. Thanks, James. Thanks for that. Really important.
Thank you. See you tomorrow.
Thank you. I think we're moving on to Amelia and Amy now to talk to us about Neurodiversity Week.
Hi everyone. Yeah, so this week is Neurodiversity Celebration Week. Amy is going to share some slides. Hopefully, if we can get them working, perfect. Thank you, Amy. So yeah, it's Neurodiversity Celebration Week, and we really want to utilise this opportunity to really increase everybody's awareness and understanding of neurodiversity, but also remind colleagues of the support that we already have available here at Sherwood for our neurodiverse colleagues. So this Thursday, we're going to be hosting a virtual half-an-hour lunch and learn session. It will be on Teams, and this half-an-hour session is there to give our colleagues a greater understanding of neurodiversity and also explore the roles that actually every single one of us can play in making sure that our teams are safe and inclusive for our neurodiverse colleagues. So, if you want to learn a bit more about neurodiversity, if it's something that you've not heard of before, if it's something that's really new to you, if you are a neurodiverse colleague, please come along and join us for that session. It will be really useful, and we'll go through some really useful information and explore some of the support that I'm going to talk about next in a bit more detail as well. So if you could go to the next slide, Amy. Thank you. So yeah, as I mentioned, we actually already offer a really, really strong amount of support for our neurodiverse colleagues. And so we just want to utilise this opportunity to remind everybody of what we already have and to make you aware if you weren't already so. So we have things like our neurodiversity e-learning, and we have a pre-recorded training video that Amy and I have completed, and we also have a frequently asked questions sheet relating to neurodiversity as well. This sheet can answer some of your initial questions that you might have. You might have never had a conversation about neurodiversity before, and you might have just some questions that you need answering before you start to embark on those conversations, and that frequently asked questions sheet can be a really good place to start with that. So there's some of the learning resources that we have for everybody to develop their awareness and understanding of neurodiversity as well. But we also have things such as the neurodiversity guidance and the health passport as well. And these can directly support you to support neurodiverse colleagues within your teams, whether that's through thinking about how somebody might be able to do their role a little bit differently, thinking about some of the different reasonable adjustments that we can implement to support our colleagues. The neurodiversity guidance and the health passport are a really important tool and resource to support you do that, and it's particularly important if you do directly line manage somebody who is neurodiverse as well. So all of the resources that are on the screen at the moment are available on the intranet page in one single place. So if you go to the staff networks section of the intranet page and click on the one staff network, all of this is there under neurodiversity support resources, and anybody can access all of this. The training that's on the e-Academy is open to everybody. Anybody can do it at any time. And speaking of the one network, it's a good opportunity for me to pass over to Amy now, who is going to give a bit of an overview of the One Network and what the One Network can do to support our colleagues who are neurodiverse.
Brilliant. Thanks, Amelia. I'm really looking forward to doing the session that we've got booked as well. So as Amelia said, I'm here to talk about the One Network. So One stands for We Are Able and Disabled. And what we called it One Network. It's called the One Network because we recognise there's difference, but there's almost a bit of magic in that difference that we might see in colleagues that have a disability. And being neurodiverse, you can or classed as having a disability, although people wouldn't necessarily associate it with that. So we're really excited to invite any colleagues to join the One Network for some peer support in a bit of a safe space. We also usually have a bit of a theme going. Of course, this week's session it is all around neurodiversity because it's Neurodiversity Celebration Week. So the next one is actually tomorrow at 12 o'clock. 12 till 1, but you can drop in for as much or as little of that as you can make if you can't make the whole thing. We meet over Teams at the moment just so we can connect with people across the organisation, but it's a really safe space to come just talk to each other. connect with someone that might be struggling with something that you're struggling with, but equally an opportunity to celebrate the things that are going quite well as well. So we talk about anything really in that safe, confidential space also. So if you want to join, if you can see the email address on the screen there, just drop us an email. Amelia or I will send you a little form to fill in so that we can just get a little bit of information from you, but you'll get the invites for meetings if you can make them, which are every 2 months. But also, if there's anything interesting to send you around disability and awareness, things that we can send you out with links, and then they'll come out to you because you'll be on our distribution list as well. And equally, even if you can't make the meeting but you want to connect with others, we can sort of connect you up or offer you support as well over email where possible, just directing you to different bits of signposting that we have also. So yeah, hopefully I've convinced you to join, and I might see some of you there tomorrow or in a couple of months' time, if not in this next one. But if you see me around, you'll see me with my wellbeing, wearing my wellbeing hat, but also my staff network hat never leaves me as well. So I look forward to seeing you then. That's it from me.
I think it's just worth mentioning that the links to all the resources that we've spoken about and the link to join up for the Lunch and Learn session on Thursday have been popped in the chat as well. So please do join us on Thursday.
Thank you both. Important stuff in there, and I think Amelia's point's really vital. We're rattling stuff off today, a lot of information and dates and etc. And if you're like me, it takes me a while to take all that in. So all those links and all those dates and all the things we've already spoken about are in the chat. Liv does a good job dropping that in, so that they'll stay in there as well after this finishes. Thank you both. That brings us on to Mohammed and Jacqueline, who are going to talk to us about this year's National Staff Survey results. So some good headlines already, both that I've seen, some really positive stuff in there, and some really important things we know we need to continue to focus on. So I'll pass over to both of you. Keep your questions coming as well.
Well, thank you very much, Phil, for that. So yeah, we're talking about National Staff Survey. The results of the embargo lifted on Thursday. So we've been chucking away looking at the results, but also looking at some of the areas that we wanted to identify in terms of improving over the next year before the staff survey launches again October, November time in 2025. So just a bit of a content what we're going to cover today, just a bit of background about the National Staff Survey for 2024, organisation details in terms of comparison over the 122 acute trusts that we compared to, how the people promise scores we scored on, where we rank with those, a summary of the results, key focuses for 2025, and then our next steps. That's what we're going to be talking about. So me and Jacqueline will do a duo. I'll start initially, and then I'll hand over to Jacqueline. So just a bit of background. The National Staff Survey is essential listening to that the NHS uses, that every trust has to participate. It normally happens in October. We get a different date every single year, but it's normally October and normally runs for about 8 weeks. And this year we did over 5,000 colleagues that were invited in the trust to participate in the staff survey. And that was via email, where you had an email link to complete the survey, or your division decided to do paper-based. And we had a mixed model this year of paper and online link. The engagement is heavily driven by my team, but also the leadership team and the divisional leads. I had the opportunity to walk around with the execs every single week to look at different teams and promote the National Staff Survey, but also listen to feedback about how we can drive the National Staff Survey going forward as well. So it's a great opportunity to me to understand the trust better, because I've only been here for a year and a half. But it's a great engagement tool for you to share your voice in an anonymous forum, in a confidential forum, but also for us as a trust to identify areas that we can improve on, but also celebrate some of the great things that we do at Sheriff Hospital Trusts. In terms of organisation detail, our response rate for 2024 was 63%. That's the highest response rate that we've had over the last few years. We heard from more voices than ever before compared to the whole trust, which is fantastic that we had so many voices complete the survey. Obviously, the median response for the staff survey was 49%. So we're averaging about 14% every single year above the average score that other trusts complete. So we're compared to 122 trusts across the whole of England, and they're the acute trust and community trust that we're compared to. In terms of people promise scores, I'll hand on over to Jacqueline, and she'll tell you about the scoring and some of the things that we're going to do in terms of the focus for 2025.
Thanks, Mohammed. Good afternoon, everyone. So the National Staff Survey is split into the areas that you can see below in terms of the people promise themes that we look at in terms of the staff survey. And as you can see from those results, you've got the organisation results, which are in the dark blue column, the average results across all of the 122 organisations that Mohammed referenced earlier on, which is the light blue column. And then you've obviously got the lines across, which are the worst results in the orange, and then the best results, which are in the green. And as you can see from that chart, we are incredibly proud to share with you that we are above average results from all the 122 acute trusts in terms of all of those people promise themes. So we continue to perform incredibly well as an organisation, and as you can see from that, there are some clear areas where we have just about or just below the best results out of those 122 organisations. So as you can see, across all of those domains, we have performed incredibly well in terms of our survey results. So key headlines then from those results. So obviously you will have seen through communications last week that we published we are the best acute trust in the East Midlands for the 7th year running, with just under 71% of you recommending Sherwood Forest as a place to work. We continue to be the best acute trust in the East Midlands for receiving care, with 73% of you recommending the organisation to a friend or relative if they needed any treatment, and you'd be happy with the standard of care provided. So again, incredibly proud of that. We continue to benchmark really, really well in terms of across the East Midlands, so we're incredibly proud. I think it's also fair to say as well, we benchmark incredibly well regionally across the Midlands region, being in the top 3 for those people promise themes in the Midlands, and also we benchmark incredibly well nationally, and we are in the top 20 across all of those people promise themes, and that is out of 122 acute trusts. So we should be incredibly proud of those results, and thank you, as Mohammed said, to each and every one of you who's taken the time to share your thoughts and feelings about working at Sherwood. So thank you for that. And then that's just a table just showing where we sit regionally. As I say, 8 out of 9 of those people promise themes, we are in the top 3. So yeah, again, performing really well as regionally as well. So I think we can skip that one, Mohammed, because I think we've just gone over that. So other key highlights from the staff survey, as well as I say, performing incredibly well and being a recommended trust to work for and receive care across the East Midlands. What we have found in terms of the staff survey results is that staff morale and staff engagement remain incredibly high across the organisation. 63.5% of you believe that we're taking positive action on health and wellbeing, which is really good to see. Just under 90% of you feel their role makes a difference to patient and service users, and 91% of colleagues feel trusted to do their job. So those are quite a few things there we are incredibly proud of. And 81% of you have not experienced physical violence, and 75.3% of you have not faced harassment or abuse from patients, relatives, or the public. And that is one of our most improved areas over the past 3 years, and that's testimony to the work that we've been doing in focusing on violence and aggression agenda across the organisation. So we're really, really, again, pleased to see that we're making some headway in supporting colleagues in terms of that area of focus, and that is an area of focus we will continue to make throughout 2025 as well. Also pleased to see that more staff have received appraisal in the last 12 months, with 90% of you receiving an appraisal. And again, positive to see that you feel that managers are taking a more positive interest in colleagues' health and wellbeing. So they are just some of the highlights across the organisation and from the results of the survey. What we do know is that we still have more work to do, and there's still more areas that we want to focus on as we move into 2025. And this is on the back of your voice and what you have said in terms of your thoughts and feelings around working at Sherwood Forest. And these are the focus areas that we want to keep for 2025. So we recognise that there is a proportion of you who are thinking of moving and leaving the organisation within the next 12 months. But what we want to do is support you to retain and within the organisation. We recognise that there's lots of knowledge and skills that we have across the organisation, and we want to try and retain people. We know that there aren't posts for everybody, and sometimes career development is a little limited in some areas. However, what we want to do is bring a process in around thinking of moving to ensure that we have those open conversations with you to see what other support we can give in terms of your career development or your role development, because there may be other areas across the trust that you've not thought about working in before. We equally also want to understand why people are leaving the organisation. So we've introduced a new exit interview process, which will be rolled out further across the trust in 2025 to help understand the themes and trends and what we can do to change some of that going forward. We recognise, and from the feedback that we've given, that colleagues feel that they don't have the right equipment they need to do their job. And that's incredibly tricky at the moment, balancing that against some of the financial constraints we've got across the organisation. But what we do recognise is that people do need the basics to be able to do their job. So we're going to go back to basics and have a look at how we can support people with that. Phil mentioned earlier on about the celebration and recognition across the trust, and we want to review that to make sure that every single one of you are thanked, every single one of you are appreciated across the organisation. We know that there are some great pockets of work that are going on in terms of celebration and recognition. Phil mentioned earlier the Tulip and the Daisy Awards, but we want to go a little bit further with that. So that's going to be another key focus for 2025. We will ensure that the care values continue to be at the heart of everything that we do, and we will make more focus on that more across 2025. And we will look at reporting and addressing unsafe clinical practices so that you all feel confident that as a trust we would address any concerns. So they're the key focus areas for 2025, and that's all based on the information that you have given from the staff survey results. So again, just want to thank everybody for taking the time to complete the staff survey. It is really, really important that we hear from everyone, so thank you. So in terms of next steps, so we now have a full suite of results that we can now share with you all. And there will be a specific staff portal link that will be available on the intranet shortly, and we will message that out once that goes live. But that gives every team and every individual across the organisation the opportunity to have a look at your own staff survey results as a team, so you can really see where some of your key areas of focus are. Senior teams across divisions have already had that information, so we're working really, really closely with them, and I know that they have plans in place to work closely with you as well across your teams to help understand what those results mean and what we can do with those results to help drive improvements across your own teams. And we will, of course, keep you updated through our channels throughout the year on some of the actions that we're taking forward and what we've done so far in terms of those staff survey results. Is there anything else you would like to add, Mohammed?
No, Jacqueline, you covered everything. Thank you.
Thank you both. Really impressive, those, and something you should all be proud of. This is your trust, your organisation. It's not about us on this call. It's about all of you. I think it's really important we do celebrate and recognise that, but equally it's important that we acknowledge there's a lot more work to do and a lot more improvements to make across all those areas. Jacqueline's pulled out some of the key ones, but there will be others. I think I welcome both of your views, but people on the call, what we want them to do is understand their local data and encourage you to ask your line managers, your teams to share with you.
Yep.
What's your team like? What are you saying about each other? I think we all need to own our little bit, and that's how we get this aggregated success. So there's some big trust-wide things that myself and exec colleagues need to lead on and support you with. There'll be some stuff in your department about how how you treat each other, how you talk to each other, about how you operate as a team. So understand your local intelligence, your local information, see how you can influence and improve the areas you work in. That's what my sort of ask would be. Would you agree with that?
I would agree with that, Phil. Yes, and I think it's about important if your teams haven't shared your results with you, ask for the results, ask to see them, ask to have that discussion. As Phil said, there are some real key focus areas as an organiser trust that we know we need to focus on, but some of those may be slightly different and may differ to what you may need in your own areas. So it really, really is important that you do have a look at those results as teams and have those really, really important discussions. I think as well, what's also fair to say is that these results are a snapshot in time. So that was as at October and November 2024. Clearly, we're quite a few months down the line now, so things could have changed. Things may have got better, or things there may be more areas of focus that you want to talk about. But again, that's really, really important that you have those discussions as a team.
I think it's been a really difficult, challenging year. We say this all the time, but each year gets harder. So to get results like that against that backdrop of the challenge and the pressure that you all work under and the pressure the NHS is under, I think it for me, it just magnifies even more how impressive these results are. But next year ain't going to be any easier. I think it's back to that bit about focus on the bits that you can all influence and impact. And sometimes we spend a lot of time worrying about the things that are out of our control and aren't right. Again, my plea will be what can you do? What's in your circle of influence? What can I do within my team, to my colleagues and my patients, that makes a positive difference or a better work environment? So ask for that information, demand it from your teams, understand it, interrogate it, and use it to improve. And equally, escalate and share ideas and things that you think we need to focus on as divisional teams or executives. But this is about all of us on our organisation. So I suppose what I'm saying is celebrate, be proud, but don't sit back and rest on our laurels. What next, and how do we improve? And that's why we do well, because we always strive to do better. So no questions coming. You've done well to dodge that on staff survey, but again, a lot in there. And again, we'll send the links out. And if there's things you want to talk to Jacqueline or Mohammed about, outside of your teams, then reach out to them and we can support you in that way. I think that brings us to the end of the main agenda items. Anything colleagues on the call with me want to add or share that we haven't already done? The sun's out. It feels a bit more spring-like, a bit more daylight, makes us all feel a bit better. It remains busy and pressured. You're all doing a fantastic job. I genuinely appreciate the impact that you all make. It feels hard at times and you might not always feel appreciated, but we certainly value all that you do. Some key things we've spoken about today, I just would reinforce the celebration of Paul Robinson next Thursday. For me, is something that's really important to me personally. I know to many of you. So if you want to come and recognise and celebrate and thank Paul, and as I say, his family may be there, I think it's really important we do that. We'll think of some other ways we remember Paul over the coming year, but this is something that we wanted to do after the funeral, which I say is tomorrow. So next Thursday, if you can come down and if you can just drop in for a short period of time, that would be really good. So thanks for all you're doing. I hope you have a good day. We'll see you soon. Take care.